You're listening to Barbell Logic,
the podcast where we talk about what it means to experience strength
and how you can use simple, hard, and effective strategies in training and nutrition to improve your life.
It starts with meeting you where you are right now and finding lasting solutions.
Welcome to the show.
Welcome, everybody, to the Barbell Logic podcast. It's so awesome to have you here with us. Joined today with my co-host, CJ.
Ahoy.
Ahoy. I just love imagining that everybody who's like doing the dishes or walking or driving right now just says ahoy back to you. Makes me happy to think about that.
Would warm my heart.
And we're joined today by a coach who's very special to me because she's my coach and very special to the Barbell Logic team. We're joined by Bekah Krieg.
Hey,
nice to have you
hi
here.
Everybody. It's good to be here.
You've heard her before, but Bekah, do you want to give a little intro about yourself and
Sure.
to kind of set up? You don't know what we're talking about today, but this is why it matters who Bekah is.
Yeah, that's right. Well, I am Bekah Krieg. I am a strength coach, obviously, but I also worked as a physical therapy assistant for 20 some years, most of it in orthopedic, but also in some like geriatric stuff. I've also been a strength coach since, let's see, like 2012, probably something like that. So, my passion is definitely seeing someone overcome injury, weakness, and get way past where you get from physical therapy to being even more strong and capable. And so I guess I am here because I deal with a lot of people with back pain and I have for a long time, for a lot of years. So that's why I'm here, I think.
Yeah. Good.
So,
yep. Good answer.
Yeah. Okay.
I didn't know how long you'd been, serving as a PTA. Like 20 years feels so long for me.
So cool.
Dude, that gives my age out, of course. But yeah. So I think I worked 9 years in orthopedic exclusively. And then like a few years, then I had some kids in there. So like didn't work for a couple of years, but then started part-time. And I was doing a little bit of both, like geriatric and orthopedic, which are very related more than you'd think. In the end, I actually ran a clinic. I was the director of it. So like hired therapists and ran a clinic and did both home health and skilled nursing stuff. So I've done a little bit of everything, but I like people. So I'm always in a people job.
And that's really impressive how many people you must have interacted with who have been probably going through rather challenging times of like experiencing an injury or experiencing pain. And it seems like usually when it's back related, it's a long-term and a really scary situation for most.
Yes, it is. I think back pain is unique in its scariness because I think everyone has met someone who has turned into, like whether it's a relative or someone who used to be able to do this and got a back injury or who has a bad back, quote, and their life is like never the same, right? Like, and I think that's a big fear that people who hurt their back have is I am now like a ruined good. I'm not gonna like be able to do what I did before. And you break your leg or you have a shoulder surgery, there seems to be like this timeline where you can expect to be back to things. But a lot of times back injuries last a long time and they reoccur. And, you've seen an older person whose spine just looks a mess by the time they're like 60 years old. And it can be scary because it can feel like all my life as I knew it is over. That's definitely feelings that people who have back pain have, I think. And I think that's one of the reasons. And not only that, but back pain is very common.
Right.
I think I've seen statistics, 50 to 60% of people will experience back pain in their lifetime. So it's a common injury, but it definitely can be a scary one.
Just before we got on the call, just out of curiosity, I pulled up some data. And what shocked me was there was a longitudinal survey globally of point prevalence. So how many people, how many adults, because they were surveying, have back pain right now? Just like right meow.
Right. Snapshot.
And it came out to an average of 8%. Which, like, when they
right.
sat in the doctor's office and said, and a little bit more women, a little bit fewer men, but for the most part, they were pretty close. And 8%.
That's a lot. That's significant.
The thought that came to me is if I'm coaching 20 clients, 25 clients, whatever, whether or not they were lifters at all, I would expect 2 of them to be dealing with back pain.
Right. And let's be honest, too, the stigma with weightlifting is you shouldn't do that because you're going to hurt your back, right? Like, so There's people who enter weightlifting with a fear of hurting their back, like a little more than even tennis or something, which is not accurate. Like you've just as much chance of hurting your back in tennis as you do in something else. But there is that stigma that heavy weight means back pain. And it's not completely unfounded. Like the more intense an activity is, the more severe the injury can be. But I think weightlifting has that sort of, I'm afraid to hurt myself. I even have young clients, very young clients, who that's one of their biggest fears on their questionnaire is like, I want to get stronger, but I don't want to hurt myself, right? And I think a lot of that is back issues that they're thinking about.
It may also be true that people could never have lifted a day in their life and also have back pain.
Yes, 100%. I think they're more at risk. The people who don't do anything are more at risk at back pain than someone who is active. So yeah, 100%.
I'm sure we're going to get to this later. When it comes to people's thoughts and fears and how to handle, lifters' thoughts and fears when it happens, one of the things I run into, just as kind of an intro, because that comment sparked the thought, if it's so common and it happens to everyone, the question is to me as a coach is, what do we attribute our back pain to? Because the stigma exists that weightlifting causes back pain or aggravates it or may something like that, it's risky, then whenever it happens, our lifters are more likely to look at weightlifting as the cause of it. If we haven't, educated or developed that rapport, they don't have that mindset that it is part of the human experience.
Yeah, that's a very good point to clarify. And I think to, as a coach, be able to articulate to people, because I think this is my philosophy on back pain and just generally why it happens. First of all, it happens because it happens. It can literally not be explained like across the board. Like some people have hurt their back when they were fit and when they were not fit, and it's like the same injury. Okay. So like just knowing that it's literally like taxes, paying bills, it happens sometimes and you have to just deal with it. So that's the sad fact. But there are patterns. Like we can't completely explain away like, oh, it's just going to happen. The pattern is that you begin to do something you're not conditioned to do, or you become more deconditioned doing your everyday life, which is, I think, the person laying on the couch, right? And that's really what strength training is. It's taking our bodies and conditioning them to move loads, move around in our environment, right? Conditioning as well, not just strength training, I would say. But there is a pattern that when you talk to someone who's having an incidence of back pain, they have either done something they're not conditioned to do or have done something very aggressive. Like back pain is common in football, right? Like, because you're hitting someone, like there is increased stress, there is increased load on the spine. So saying that load and things has nothing to do with whether or not you're going to injure your back is not really truthful either. However, if you're training and, developing something over time, that can be done extremely safely, which we all know because we've seen people who have had back pain who start strength training and their back pain goes away, like they don't have it anymore. So I think back pain happens for a couple of reasons. First of all, because someone has done something they're deconditioned for, or they've become more deconditioned to do things they used to do. And that's what happens with like work, right? Like somebody who works 12-hour shifts and is having more trouble staying on their feet for 12 hours, or they deliver packages and all of a sudden, like, my back is starting to hurt on these shifts that I'm working. But when they come home on the weekends, they lay around all weekend and don't do anything. And so over years and years, they become like less conditioned than they were when they started their job. The other side of it is that the spine, as compared to other joints in our body, is extremely complex, like extremely complex. The thing that's awesome about it is it has such a capacity for strength and mobility all at the same time compared to any other joint. Everything we do is either transmitting force through our spine or our spine is acting as decompression for whatever activity we're throwing at it. And if you think of the neck, the upper back, the low back, the rib cage, all of that is working together. Do you know how many muscles that is that are working together? It's like really each little vertebrae, and I've had these out looking at them all day, but each little vertebrae is like a marionette as far as how many muscles are attached to it, right? Like a puppet. I mean, it really is like each little segment can move and turn in different directions. And every facet on each vertebrae has a teeny little muscle attached to it, let alone our big, strong back muscles that are attached to our whole spine. So the incidence of injury is just higher because we have so many pieces that are working together to make our spine operate. So I think just the complexity of that and the fact that our spine doesn't get a break, whether we're sitting, standing, moving something, like it's a workhorse, like it's just going to get injured sometimes. So I think like when you're talking to your clients and if they're afraid of getting injured or if they're already injured, I think the message needs to be, let's take the way you move right now and let's make it better. Let's make your muscles stronger, more better capable of holding your back in good position. And let's work you through this. Your spine, while it can get injured, is remarkably strong as well. It doesn't break easily. It can withstand a lot and it can heal like a lot. So I think, the scariness of it is how debilitating it feels when your back hurts. But it just like anything else. I mean, if your wrist hurts, you just don't use your wrist, right? But if your spine hurts, you can't not use your spine.
It's a little important.
It is, right? And that's what makes it scary because you're like, I feel like I can't do anything. I'm in pain no matter what I do. Like getting out of bed, getting into the car, getting out of the car, trying to hold my kid, trying to do the dishes. Like everything hurts. So that's why, and that emotional impact of how devastating it feels becomes intertwined with it too. So that's really hard to unpack. Yeah.
Yeah, I've picked up a really cool learning from you and from learning more about back pain is it's not like you just said an acute something like you hurt your wrist. It is a pattern before. There's a moment where it kind of really gets your attention and then there's a pattern after. And I think we try to look to the pattern before to learn a lot. That's something that's really important. Like, okay, it can influence the pattern afterward, but the pattern afterward has a lot to do with mindset in addition to what kind of interventions you implement. But in order to kind of train the fear, you have to kind of learn a new pattern of what you do in response to an onset of pain. And so pattern is the word that keeps coming to mind whenever I think about back pain as pattern before, pattern after, and it kind of helps you take it away from this one big scary moment.
Right. Because of some of the theories of pain, some people try to say like, there's no injury, right? There's not really an injury. It's just pain. It's not injured or not injured, which I'm not sure I totally love that mindset. Like there's something to that mindset because it is like, if you feel you're injured, that psychology, like, oh no, I'm injured, devastation, what am I going to do? That sort of sentiment, that psychological impact is huge.
Yeah.
And it is not to be underestimated. Like in all the people I've ever worked with, and I'm sure, I mean, it must be hundreds of people with back pain that I've worked with in my time as PT in this, there's a mindset that especially someone with chronic back pain develops. Sometimes I feel like it's life stress starts the back pain and then it becomes a cycle because it is in how you approach it. However, there mechanical issues, there's a lot of things that can mechanically be wrong with your back, right? So you can't just like brush it under, like it's in your mind, don't think about it. If you've injured your back, it's more easy to injure your back again because it's held together with ligaments and you overstretch those or you have a disc issue. Like there's a million things. It is easier to re-injure your back than it is to keep it healthy. It takes more work to keep it healthy. And so, to say there's no injury mechanism is a little bit of an oversimplification in my mind. I feel like it's both, right? Like it's both things. But I've seen a guy whose wife is in the hospital. He comes in to me and I'm working with him 3 days a week and his back is like a mess, like so tight, can barely move. And we get him feeling a little bit better. But then wife gets out of the hospital and he comes in and he's like, I feel great. And he has not made a correlation with the stress in his life. But I'm sitting there like, well, this will help a lot, right? Like this is probably what's going to push you over the edge. So you cannot underestimate either that feeling of stress because stress is a background noise that I think interferes with how we feel about the injury, right? And that can catastrophize the pain too, because it can just make it feel just like when you're tired and you stub your toe, you might cry a little harder over it than if you're not, right? Like it's true. If you're exhausted and you hurt yourself,
It's worse.
it hurts worse. It hurts worse. And that's just being human, right? Like and that's the same thing with background stress. Like, and there are people who just don't even feel pain very much and their stress comes out in different ways. But for most people, pain is an indication of, mechanically something could be wrong. I've developed a bad pattern of taking care of my body, or I'm more stressed out than I thought.
If I can add an anecdote that kind of, for me, highlights, the role as a coach, because there was a time when I was, like, oh, back injuries, I can't coach that, I can't touch that. And then you swing to the other side of the pendulum, which is, everyone gets their back tweaked and whatever, just to keep them on the bar right away. If they tell you they have chronic back pain, like, it's your job to sell them on the fact that barbells will fix them. Although I was always very cautious about actually saying that, I would admit that that was in my mind. I was tempering what I was thinking, but I think we have to be very careful about that. Just like you said, certainly modulated by stress and by pain and by all that. I had a friend of mine who experienced back pain from lifting and went 6 months with varying levels of pain in and out, and went to a provider. And the provider says, it's not an injury. I mean, it would have healed by now. The healing timelines and, going on that. And this is a licensed provider. So get back to the bar, and recommended heavier weight for a few reps.
Awesome.
And that's the idea, like introduce, and the lifter experienced like more pain. It got worse. That was the one outcome he didn't expect. He was almost like, oh, thank goodness, the guy's right. Like, I just need to get back on the bar. And it actually got worse. And he's still dealing with it now. So there's always that balance, to the point where as a coach, that's one of the things I'm hoping to discuss and bring up. And especially for new coaches.
Right.
That the harm of rushing off and telling the lifter, nope, don't touch the barbell, get off, don't work, sit on your couch. The harm there is immediate and apparent, and has probably hurt more people than any other common advice that we hear as coaches. But it's a little too much to say, you're not hurt.
Right.
Just walk it off.
Yeah.
That's the old high school coach, walk it off.
Right. And I do think, like, if someone can walk off back pain, they already have. If you're not really injured, unless you are having some psychosocial attachment to the back pain, which is very real, and you can have that without even knowing it. You just are like in love with feeling a little miserable. That's another side of psychology of it. But if you don't overreact to back pain and you have it, you just like, kind of shake it off, you're going to be in the gym in 2 days and you're going to be fine. We don't have to solve that as coaches. That's not a problem. That's someone who already has a good mentality about an injury, and to, not be afraid to move. So they're going to move, and then they're going to feel better. Right. So those people are easy. And that happens, right? Like that happens. Like my son is like that. Like he will have like, oh, my back is out. But then he's like in the gym next day and he's fine. Right. Because he's not afraid of that happening to him. He's young and he thinks he's invincible. Yes, Bear, I said it. You think you're invincible. But, that's not a problem. He's not hard to deal with, because that's true. But I do think we can definitely get into the sideboard to just like put it in the you're not injured category. Position matters. I've rarely found a case where position doesn't matter. And position matters because, you're talking about, especially when you talk about a loaded versus an unloaded spine, like the way your spine aligns when it's loaded with under compression, like in a squat, versus when you're sitting in a chair, like a pilot sitting on a long flight, is different. And it causes a little bit of different stress through the spine. But with a little bit of poor posture, a little bit of overstrain, like a little bit of tightness in the like erectors or something, like you're putting weird stress through the spine, and it hurts. It hurts after a while, And so just assuming that someone's just feeling it because they're stressed out is also erroneous. To like you said, the pendulum to swing all the way that way is probably doing your client a disservice also.
I remember I had a pilot client. He was an F-18. He wasn't a client. I was just learning with him. But he was one of those classic cases where he had back pain from flying. And then he would tell me that the back pain would only go away when he was doing his deadlifts and keeping up with training.
Yeah. Right. Have you ever thought about why that is? Because it's very, very common. I mean, a therapist looks at back pain. Well, some don't, because there's some people that are like all one theory, but, is this a flexion back injury or extension back injury? Like a lot of people feel better when they can use their muscles, get blood flowing, and get their back into a nice full extension. Like when I say extension, I mean like neutral, like not hyperextension. The reason that is because you're using all of your muscles to like stack up your vertebrae the way they were meant to be in the first place. Plus you're lifting heavy weight, which is like pumping blood to those muscles. Like it's just like medicine, right? So many people feel better when they lift, like so many, like that's more the case than not. But if someone doesn't feel better when they lift, to me, that's a question mark. Like, if they're not panicking and if they're not like catastrophizing what's happening to them, I do think like, hey, maybe there's something going on here. And it doesn't have to be like, I have a herniated disc, because sometimes it's just a poor movement pattern that you've after an incident of pain that has, caused some more issues and needs to be examined. So I don't know. That's how I look at it.
Whenever we got to, discussing the scenario types, one of my things when I coach CrossFit was, people would come in and every day somebody would come in, my elbow's feeling weird. My shoulder's feeling weird. My back's kind of off. And my answer was always, okay, let's get through the warm up.
Right.
Let's just kind of ease into the work. And if you report pain, and then 90% of the time, by the time we get to the workout, they've forgotten about it.
Yeah.
And, it's a non-issue. And then for those people, if you can get through a whole warm up and you get to the end and it's like, coach, it hadn't gotten any better. It's kind of still bugging me through the warm up. Then at that point, I am more than happy to back off the exercises, to back off load, to change, range of motion, to change exercises entirely. Like you're not doing muscle ups with a freaking busted shoulder.
Right. Right. And that's such a good point, because more often than not, a warmed up body feels better. Back pain or otherwise, like it doesn't matter. But that's especially true like when your spine is the thing that's feeling tight and tired. And a lot of people with back pain, they feel worse in the morning. And that's because they're not warmed up. Right. So it's definitely wise as a coach to be like, hey, let's do a light warm up. Let's get you on a rower. Let's get you on a bike. Let's get your body temperature elevated. Let's do some warm ups. Let's do some body weight squats. Let's see how you feel with this. Do some RDLs. And sometimes the body just needs a little slower warm up. Like that is more often than not like a cure for what ails us. So, and most of us try to rush through warm ups anyway.
I find for me that the mindset ends up being like, I try to stay away from diagnosing, in the sense of I try to stay away from imagining or conceiving what the back injury could be. Because like if it's diet, if somebody's failing to lose weight and they're reporting certain things and blah, 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 I've got a pretty good picture for, let's say they're on a macro plan, why they might not be losing weight, even though the macro plan says they should be. There's plenty of reasons, and I have a lot of personal experience with that. If somebody says, I've got back pain, we go through the warm up, they're still hurting, something like that. I know there are coaches who are like, okay, let's see if it's lateral, let's try suitcase deadlifts. Let's see if it's flexion. Let's see if extension. They try to run through a series. Let's put you on your back and I'm going to, do a manual roll that's where I get, because I feel like as not just a licensed practitioner, but knowing how many licensed practitioners are struggling to clarify diagnoses.
Right. Yeah.
I'm like, I am more likely to trick myself into imagining a diagnosis or a cause than I am to actually find a cause. Because if there is a mechanical cause, I don't even know what I could do about it.
Exactly. I think that's very smart. And I think you don't need to, right? Like most of the time, because back pain happens at such a high incidence rate, you don't need to know why the person's back hurts. You need to reassure them that this can happen and it's okay. And I'm your coach. I'm going to help guide you through some adaptations. We're not here to kill you or make you feel terrible. We're going to do things that are safe for your back and take them through, what is a nice warm up, simple progression, and see what they can do, because we know movement helps almost all the time. But I do think as a coach, quietly, as you're watching the client, if something isn't working or they're complaining, especially of pain, like they got through the workout fine, but they went home and they're like, man, I couldn't really walk last night. Like it got really bad. That's a little more of a red flag to me, right? Like
that's the one I am least sure about what to do. Cause so lifter has a tweak on the platform. I feel really confident about that.
Yeah.
Lifter comes in with a chronic ache or something. My first strategy is reduce load. So reduce load to a weight they can manage. If that's below, like in a deadlift, if it's below 135 or even below half whatever their working weight is, that's a signal to me we're not getting through that training day. Like not the way it was planned.
Right, exactly.
So first reduce load, then reduce range of motion or change variation, which reducing range of motion is selecting a different variant.
Right.
If it's the day of, I'd prefer to keep, like they have a tweak right then. I'd prefer that the pain be like below, like 2 or below. And then for the first few sessions afterwards, just to build confidence, we'll stick to a variant and a load that will like keep pain 1 or below generally, and maybe poke that a little bit, but not too much. And then before I start jacking up the load, I'm going to bring the variant back. So like, let's say we put them on block pulls or rack pulls. we'll go through a couple of lifts, a couple of days, then extend to get closer to the floor. How's your back doing? Okay, then we start bringing back load.
Right. I think that's awesome. I think that's what a lot of coaches that we work with use. Well, it's kind of what we tell people to do, right, in the academy too, because it's sound, because you're letting pain be your guide. You are not letting them do nothing, because that's important. And like with the idea that some movement matters and helps, right? So like if you can get some load on the bar and get through like, a pretty normal squat pattern or a reduced range of motion deadlift, like that's helpful. That's helpful. The person is going to feel better. I think that's awesome. The only other thing I would add to that I do, because you'd be surprised how many times the tweak on the platform happens with a warm up, right? Doesn't it normally? Like as they're just like warming up, like depending on how bad it is, like sometimes I go back to the warm up before and I'm like, let's refocus on bracing. Like do another one here, brace, and then try it again. Sometimes that's the only thing I would add. It's because occasionally people are super lazy they're like, I know this is only 135. So I look like I'm bracing and I'm kind of breathing big, but I'm not really like really bracing. Occasionally that's the issue, is like they're just, they took their warm up like a warm up mentally and didn't brace very hard. And the spine, once you brace really well, like loves it and it feels better. And they can actually do more then. So that's the only thing I would add. But otherwise, if the tweak is there and it stays, I would do pretty much exactly what you said, like reduce the load. Can you do 60, 70% today instead of our planned 85 or whatever? And variance, add in the variant that feels comfortable.
And I think there's a difference in scale too. I mean, like I've had the kind of back tweak where literally I take 5 minutes off, I get back on the bar and I do the same darn thing, and
yep.
It feels bad when it happens, but there's something in my head just from years of lifting where I'm like, nah.
Yeah.
But I think it was a little over a year ago now. I was doing a deadlift coming back from a wedding in London. So a lot of flying, a lot of travel, and I'm like 80% for a single. 80%'s like way low for a single, right? No,
right.
Because it's an estimated one, and I should have known better than that. The last warm up, the single at like 65, 70, no, like 70% went really well, went for 80. And immediately I'm like, something's wrong. I couldn't do, the weight was 400, like 405, I think. I couldn't do 315, couldn't do 225, hurting bad at 135.
Yeah.
And this took 4 months.
Right.
And that first moment, a tweak or something like that, which takes an extended period of time to recover from, they both hurt.
They do.
I hear from people, they're like, oh yeah, like I fixed mine in a week, or I was good to go the next session. I'm like, yeah, the same person can have two very different experiences, but it feels pretty bad when it happens.
Right. And did you really do anything different between when it was like when you brushed it off or when you didn't? Like sometimes no. Sometimes it's because you're tired and because your body was more tired, you were more stressed. And when I say stressed, I don't mean like, I'm getting audited by the IRS or something. I mean like the little things that have added up in your day that you're like, oh, wow, I'm more stressed than I thought. Like, and I think, that can be the difference in how you handle one way this time and then handle it a different way next time. And it's not a mental change. You weren't less tough that time. Of course you're tough. You're like, you train people to be tough, mentally tough, but it is about like just the condition your body was in as it was trying to get past that incident of pain.
You asked a good question. I'm struggling to think through it because like, I feel like my process is pretty much the same, especially as a coach with a lifter, because I'm not inhabiting their body. Like,
right. You don't feel the pain.
And they might not have the same level of experience that I do to like, to just kind of pull it on the fly. Like, what am I going to do? But I find I end up following pretty much the same practice for all of my tweaks.
Yeah.
And I just, whether I'm back to game in 1 session, 2 sessions, or I'm back to game in 4 months, 5 months. Yeah. To me, that's really the biggest difference. It's just how patient do I need to be?
Right. And I think that coaches need to remember that, like you can provide that voice of reason for your clients in the moment, feeling it, right? Like it's just like if you help somebody through a cave and you can see the end, but they can't. And you say, hey, you're almost there. Like our coach voice is helpful. And like, I know it hurts right now, but you're almost there. And also to distinguish those pain feelings. Because while we don't 100% have the same experience as they do in their body, like, I don't know if you've ever had a more novice lifter, like kind of have a hard deadlift volume workout for the first time. And they say like the next day, they're like, oh, I hurt my back. And then you're like trying to get them to describe the pain a little bit. And what they're feeling is that like tightness that you get from like post volume DOMS sort of feeling. And you're like, oh yeah, that hurts, but you're going to be okay tomorrow. Trust me, it'll feel better tomorrow. Because some people would just quit and not deadlift again. They're like, I hurt myself. But just that experience you can provide to your client to be like, you might feel this way, but it's not going to stay that way. You're going to feel a little different around the corner. And I think as a coach, when it happens to you, it can still be hard. But I think because you have the experience of talking through or guiding someone through that experience, you tend to take on that mindset yourself, right? You tend to panic less if you hurt yourself. It's not true across the board, but I think for most of us, that experience is helpful in our mindset to like be like, well, let me just see how I feel tomorrow, and kind of like tiptoe our way back as best we can.
It's funny. So to anyone who's listening, Nikki had a bit of an equipment drop. So Becca and I have been jamming on the topic. Hopefully she's able to jump back in.
Not without effort on her part. She tried like 3 different headphones. Jeez. But go ahead. Sorry.
But on that topic or on that thought about coaching specifically and, the difference in our experience, I just wanted to toss in 2 things. One, that the only difference that I had as I was listening, I usually end up telling someone like, okay, we'll see how this feels tomorrow. Like, I'm willing to bet it feels better.
Right.
Just because, like, leaving that space for them to be feeling like crap when they see me, because who knows what they're going to get.
For sure.
But I think it's so funny when you're like, we as coaches, we don't panic as much. I almost feel like I remember when I had that tweak, like the bad one that lasted for, 4 months for me before I was back to 4 plates again. And a week into it or 2 weeks into it, I felt the same impatience that I know my clients feel.
Yes.
Where I'm like, I should be lifting heavier than this. Like am I never going to be back at 4 plates again? And I literally had to stop and go, CJ, you are a coach.
Yeah.
Like if you were your client right now, what would you be saying to yourself? And having to coach myself out of that catastrophization. Because we're all human.
I've been there. 100%. I've been there. Like, and you're like, did I expect that I was Superman? Like, what do I think? I'm not like, I can't.
Well, yes,
I can't
because
hurt.
I'm a coach.
Right. I know it's terrible. But I think that's another thing that makes back pain feel terrible. And it's so easy for like every little, ooh, I'm not going to be able to lift today. I felt that. Like, you're moving something around the car or whatever, and you're like, oh. And so I think having that conversation with our clients, like, I don't know when you're going to feel better, but you are. And you just need to like know that not everything is bad. Right. But I do think too, like, I also always have the conversation with my client. Like, if it does hurt, I want to know. Like, don't feel bad that you're telling me about every tweak and whatever. For most people, I say that because I don't want them to like hurt and not tell me and I not make any adaptation to their program. And then it just keeps getting worse. Right. So I do try to tell people like, it's okay. Tell me if it's not a big deal, we're not going to make a big deal out of it, but just let me know, like, that you don't feel perfect. It's okay. Right.
My communication approach on that one is like, if I feel like somebody isn't telling me something, I'll joke like, would you joke with your spouse, with your kids? Would you be like, I'm old. I'm 30, I'm 35. My life is over and my back is hurting. Like, if you would be willing to have that conversation with a casual friend or something like that, then let me know.
Right.
And I will take it at that same level. I'm going to register it.
Right.
I'm going to keep that in mind because that's my job. But, trying to communicate that the client doesn't have to be afraid or doesn't have to be afraid that I'm going to leash them, that I'm going to hold them back from training just because they complain about a tweaky knee.
Right. I tell people that too, because I'm like, look, it may feel like I'm holding you back a little bit and being conservative, because I am. There's no question I'm conservative. You can ask my clients. I'm a little bit conservative, but I don't hold people in a place where they aren't going to progress either. I try not to, right? So, and I let them know that. I'm like, don't worry, we're not doing this for a month, like we're doing this week. This is a temporary thing. I just want you to have a little bit more time. But I think that builds trust a little bit too, that you're not trying to be like, get back out there, like that kind of thing, because that can be scary too. If your coach just expects, and you could feel like I'm failing because I'm not gutting this out, right? You don't want your client to feel like that either, And there's times where you're like, suck it up. It's just going to be sore or go. I've definitely had that conversation with people. But, I have a gal now who has an annular tear in her disc. And that is a legit, painful, long thing that she's walking through. And like her big thing is like, I don't want to get on the end of this healing and not be strong. Like, I don't want to keep getting weaker. So we're doing what she can, but it's a very slow, long process. But she's been very great about communicating, and she's tough. Like, she's as tough as any athlete I've ever coached. And she's not an athlete. Like, she would tell you that. Like, she's like just a person who wants to have a capable body, but like she deals with the pain amazingly. Like, she doesn't miss workouts. She does what she can, but she can feel like a failure if things are too, like, it doesn't feel like you've gotten anywhere, right? Like, we all feel that. And I think that's what we feel as coaches is like, how come I'm not doing any better than I should? I feel like I should be. That's a hard place to be. And that's what I think you have to, allow your clients that, like, make sure that's communicated, that it's okay if it feels hard, like, just because you're not progressing, that can happen, but it's not the end of the world.
I'd like to take a different situation. So we were talking, and we've been talking kind of in and out as things come up. But we talked about like the lifter who has a tweak on the platform. You have a lot more experience with this one than I do. So I did first the last time, you do this one. But
Okay.
Chronic back pain. So someone comes and they have had back pain for an extended period of time. Like I said, I was working with a pilot, who was dealing with that. And that was relatively simple. It was a casual progression. But someone who's dealing with chronic back pain, walking in from day one, they've been to a physical therapist or multiple, usually. Oftentimes they're frustrated. They may have had their back imaged. And oftentimes they have a diagnosis like, oh, you have disc degeneration. But everyone
Right.
has disc degeneration by age 50. It feels like,
Yes.
we've looked at the numbers. It's a high prevalence. So not sure if that means anything. And then they come say, all right, coach, what can we do?
Right.
What is your approach when you're not the lifter who has the tweak on the platform, but someone who almost their life is structured around their chronic pain?
Yeah. So this is the hard part. This is a little harder for me to guide you through because I feel like I have a lot of clients like this. And I don't feel like the same answer is for everyone, but I'll tell you sort of like generally how I look at it. So if someone has a diagnosed pathology, a mechanical, like a known mechanical issue with their back, that is, to me, significant. And it's significant not in that outcome of their training, because that's very unpredictable. Like, I have people with horrible mechanical images, like on their MRIs or whatever, that do amazing, and people with like the smallest little one that struggle like so hard to progress. So to me, that isn't a life sentence like, I have a disc issue, but it's information. And anyone who has one of those mechanical breakdowns in their spine is more likely to have an issue with something, a re-injury. So I focus on better movement and better mobility, generally speaking. And just like you did with the lifter on the platform, we often start with what can you do first, right? And I do like learning how to hip hinge and brace properly when you have compression on the spine or weighted carries of any kind. That to me is the foundation of everything, because even if you're gonna have back pain, normally you can become more functional with your back pain. And if I have somebody who's super, super chronic, and I have a guy like that right now, horrible back, just like he's an athlete. He's done a lot of crazy things in his life and he's not that old, but like he has terrible images, like scary ones. Like you're like, and ridiculous symptoms that we keep an eye on. But like our goal is for him to just like keep the baseline of hurting. So like he doesn't not hurt. He just keeps the same baseline of hurting, but becomes more functional. So he squats more, he deadlifts more. We start with the progressions. We see what he can do. We slowly load it. But I do that with an extreme emphasis on a proper brace, because his best bet is to get his spine lined up as best as we can. And that means his rib cage position, his lumbar thoracic, not hyperextended, like a good position for him, like that's loadable, that he feels the least amount discomfort, no radiculopathy, and we build up from there. So that's generally what I do with someone who's like very debilitated. But there's definitely people who get the diagnosis, or even who don't have a diagnosis but have just been like battling back pain for a long time, that there's some psychological things to work through, not in a like, I'm going to fix your life like a psychologist kind of way, but in how they approach training, right? And like just how they look at it. And so sometimes I feel like my job is to be the cheerleader and be the person who's like, you can do this, and we're going to start baby step, and you're going to be more confident, and you're going to understand, I'm not going to hurt myself. I can do a little bit more. Like that whole mindset. And so that is hugely empowering as well, because as soon as someone believes they're not going to hurt themselves, all of a sudden the psychological aspect of the pain isn't as scary. You've taken away the fear. They begin to trust you, and then they can deadlift 405, right? Like before they know it, they're like, oh my gosh, I'm deadlifting 405. And I used to not be able to pull 220 off the floor without like extreme back pain for 3 days. So sometimes it's just improving the movement pattern enough that they feel good, they load better. And I do think one of the things we have to realize when we are teaching someone the barbell lifts in particular, because it's not a machine, they have to use their body to put everything in good alignment. You have to, right? So if you're not doing that very well, or you're only doing it semi-adequately, then improving your movement just a little bit or improving your mobility just a little bit can make a big difference. And when you start back at level 0 with a better movement pattern, you progress past where you were before. So that's not always a popular idea. Like, I feel like there's a lot of coaches who think like, that's a bunch of like, you're being too cautious or something like that. But to me, I'm telling you, it works. Like, it helps almost everybody because people get afraid of movement patterns too. Like, they're afraid of it. You can see them kind of like tense up or move out of it. Like if they're even doing an RDL, like they get the bar to their knee and they will not push their hips back. They're afraid to like totally hip hinge the whole way. So like if you're not going to hip hinge on an RDL, you're not going to pull a deadlift off the floor very well, right? So to me, I break it down that slow and we work on making them feel confident doing that. And once they feel confident, then they don't care about putting more weight on the bar. They're happy to do that, So that's my general approach, but it definitely depends on what that pathology says. And so I think that's where we get into those red flags, right? As coaches, like if you've tried those modifications we talked about with the lifter on the platform who has the back tweak, with someone even who came into you with back pain and you've tried progressing slowly through those and nothing's kind of working, like sometimes that's a refer out thing. And maybe they don't do the basic forward lifts. Maybe they strength train some other way, just like you would with an older person who has a very degenerated spine. You're probably not going to have them squat to depth, right? Or below parallel anyway. Have them squat to a chair. It's okay to make that kind of adaptation until someone feels well, right?
So if I can summarize what I captured from there, just in general, the first thing I heard was there's almost a conservatism, but also you mentioned the cheerleading, the push from behind, that what feels conservative to you as a coach and what other coaches may be like, that's, drive them harder. That's between you and your client.
Right.
And the fact is, from their perspective, especially if they've lived with this for quite some time, what feels too conservative for you or very conservative might actually be for them the most movement they've done in quite some time.
Right. I think that's true. And I think that is where they're like, okay, I might be able to do this, right? Like, I'm not afraid that you're going to make me do something I'm not able to do.
Another thing I heard was broadening your movement palette. You mentioned like weighted walks, weighted carries. The things that aggravate pain in the deadlift, and this is something I've noticed as well, is that there's different pieces to it. When my back got jacked up for 4 months, I learned just experimenting with different things that hip hinging was painful.
It can be.
No matter whether I was in flexion, whether I was in extension, but weighted carries were not at all.
Right.
The axial loading of a weighted carry was not a problem. So farmer's walks, yoke walks.
And there are people that present otherwise.
Exactly.
There's people that present completely opposite, and any axial loading is painful, but hip hinging feels amazing. I think that's like when you talk about a loaded spine that's injured, like it's good to kind of observe that, like which is better. I'm a trap bar deadlift fan myself for my back people too, because I feel like, and I have people set up as squatty as possible, like as far away from the traditional deadlift setup, and just like so that their spine is more vertical. Like I have a guy who I've worked with for 10 years who has a disc issue and his bulge is in a terrible place for hip hinging. Like, and I've seen it on an MRI, like it's just in the front. It's not in a normal place where people bulge discs, and he can flare it up really easily. And that's how he has to deadlift. Like we just don't even try the other kind because he can do that pain-free and, put hundreds of pounds on it and he feels good. So, but I am a fan of that too. Like, don't be stuck to my client must deadlift right now, because even if they can't do it right now, that doesn't mean they're not going to do it in the future, but they need to find something they can do right now, that they can feel better, move better, that kind of thing. And two, like just trying to get someone to stretch into a hip hinge if that's bothering them, like if it hurts, but you do want to get to the point where you can do that. So doing it without weight.
You have to be able to bend over.
Like just stretch into it. Yeah. Like, so that's where I'm saying mobility too can be a big issue. There are a ton of people that their back hurts because their hips are so tight. Like they have such tight hips. And it's probably not what you do in the gym. It's probably like everything else they're doing in their life that is beating up their back. But, you know, some people do need stretching. I think that's my opinion.
If there was a third thing that I heard, and I think this one's probably like going to be the one where if coaches are going to be like, blah, 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 you know, typing in the YouTube comments, it's your conversation, because never read the comments. It's the line on technique, because the discourse right now is there's a heavy skepticism towards the importance of technique, towards the importance of keeping a neutral spine. And I think there's a very important realization that's come about in the last 5-10 years that what we always thought was neutral, maybe we're not, you know, we don't have as clear an understanding of that.
Right.
As to nobody maintains, you know, perfectly neutral. Once you know, if you aim the tools tight enough and look close enough, once it gets heavy enough, you know, nothing's perfect.
Right.
But you point out, and I have noticed the same thing, there are movement patterns when you experiment, when you range with, where for no, like, I could not explain it because I don't diagnose as a coach, but there is no pain here.
Right. Yes.
I think there's, even if there isn't a optimal technique, you know, even if we could throw that out the window, there may be a stone soup value. Anyone who hasn't heard the stones, you know, somebody comes bringing a stone and says, I'll make a great soup. Oh, but it would be even better with your tomatoes. Oh, it would be even better with your carrots. Oh,
right.
And the next thing you know, they've got a great thing. And they're like, oh, the stone was amazing. Thank you for your contributions. It wasn't the stone at all. When we think technique, sometimes just the fact that thinking about the technique and thinking about bringing your attention to the lift, that focus, that attention, that care may also help.
Yes.
It wouldn't surprise me how many people just assume that the lift is going to hurt. And if they come in and think to themselves, like, maybe it will, maybe it won't, I need to be present and see how this lift goes. Oftentimes they're like, oh, that was a 1 when, you know, I was expecting worse.
Yeah, I think so. That is a very big debate right now. I totally agree with you. But I do think, and like you said, it might be a focus thing. It might be like the stone in the soup. It might just be like, oh, look, we're going to make this better. But I do think there are movement patterns where if you coach someone to do it, they just do feel better. And like, if you take the guy, like I was talking about, who has like horrible back, he has radiculopathy that no one can do anything about, you know, surgeon, he's been through, checked out, whatever. This is like, good luck, buddy, kind of situation, right? But if we put him in a generally neutral spine and we get his abs stronger and his low back stronger and we focus on that thing and we really have him braced down, and I've worked pin squat down to the fact so that he is to the point, because there is flexion at the bottom of a low squat. So we went right to where he felt no pain forever. Did the same thing with people with spondylolisthesis. I think that works pretty well. And he feels better when he's braced and neutral, and he can feel when he doesn't. Like, it hurts more. There is something mechanically usually more advantageous to being braced like that. And I think it is a spine under load. And that's the key. Like, I think that matters. And I think people, like, you can see people who deadlift with terrible form, really heavy, and they never hurt their back. That's out there. I'm not going to deny that that's not true. But I do think that people who just like, heavy reps, form's going to break down, so they let their back go. The more reps you do at that over time, it's not good for your back. I had a conversation with Darren Deaton about that too. Like, there are things we do that can just beat us up more, right? And so I think like that technique has a place for sure, because I see it help people is why. And I really haven't seen hardly anyone where a little technique tweak and a little deload, reload with a little bit better movement hasn't helped.
That's one of those, like, I think there's a plausible mechanical, not just a plausible mechanical explanation, but also to say that one is skeptical because our tools, you know, can't identify a cause is not to say that a cause does not exist.
Correct. Right.
And I think the discourse, like I said, may often pushes a little bit too much in that, well, because we can't prove a direct causal link between technique and pain, therefore we have to assume there is none. Yeah. Why do we have to assume that if my lifter is getting better based on these modifications? There's a level of communication that is important. I think 10, 20 years ago, you know, or even 5 years ago, there was a habit of saying, oh, if you do this, you're going to snap your back. Hell, I've posted videos on my own Instagram of me deadlifting just fine, thank you. And, you know, people coming on and saying, like, you're going to snap your back in two, that kind of thing. That language is as catastrophizing as telling someone who has a back tweak, oh, get off the bar, don't touch it.
Right.
But I think we as coaches can navigate that space and still experiment with movement that feels better.
Yes. And I think too, like the other side of back pain, and all you have to do is look at someone who's been only doing the power lifts for years and not really doing much else with their training, like training like a power lifter. That person's spine is not usually too happy when they're older, like as a rule of thumb. And I think that that's because they've done one movement pattern, like push the heavy boundary. And I'm not saying you can't do that, because you can. I have a lifter who has world records, right? Like I know I'm all about people lifting heavy, like don't get me wrong. But I also am about preserving her body for long term, right? So like we do other stuff. We make sure that we do other stuff, move her spine in a different way, move her shoulder in a different way. Like, because our bodies aren't meant to only, squat, deadlift, press, and bench. Like those are helpful, but we also have to, mow the grass and carry children, groceries, like, specialization always leads to adaptation that like is hard to reverse into other fields. And really, if you're going to specialize in those lifts, like that's what's going to happen to your body eventually, right?
So thinking back, we've gone through lifter has a tweak on the platform. We've talked a little bit about lifters with chronic back pain, kind of the psychology of that, the physicality of that. One thing I think is super important for all coaches, especially new coaches, is that scope of practice and that red flags piece. Because like what came to mind for me earlier is that although being active is better than being inactive, and moving is better than not moving, there are cases where we can make things worse, or we can lead people to not seek out medical attention by downplaying what they're experiencing.
That's correct.
Let's talk about that a little bit. I mean, from your experience and your knowledge base, what are red flags for your lifters?
I think Sully wrote a piece for us in the Academy, which is such a great little document. But the big things are, and the things that are immediate, like send the person home. Like don't even try to ride a bike or anything, is like if someone comes in and reports that they've had any bowel or bladder, like lack of control, like something like you knew they sort of had a back injury and they're like, I had this weird thing happen. Like I just didn't have any control of that, or sexual dysfunction that's like new and not like something weird like that. Also, anytime where there's like bilateral referred pain down both legs, especially, or any loss of motor function. So the biggest thing you see, first of all, usually is like a foot drop, which is like they cannot dorsiflex the foot, which dorsiflex is pull the toe up towards the nose, like, kind of get ready to put your foot on the gas pedal when you pull your foot up to step down on it. If they have trouble controlling that, or any other loss of motor control in the legs or in the neck, we can have that same sort of symptom in the neck with the arms and the hands. Those are things where you're like, you know what? Loss of motor control, anything interfering with those other physiological functions, definitely refer out. Don't even try warming up. Don't even, be like, you know what? I want you to make an appointment with your doctor. Or even, hey, why don't you stop by urgent care on the way home? Sometimes that's necessary, because you know what? I think when somebody comes to strength train, they're trying to be tough, and you just have to assume like, don't mess around with that. But the other side of it, where I think is often times where people fail to refer out, is when they have been trying to make adaptations and the client's doing okay, right? Like they're coming back. They're not like in pain in bed at home, but nothing is progressing, right? Like nothing is getting better. They're sort of having that chronic pain forever. And that's not an emergency. Like you can definitely have the training session, but you might say, you know what? I'm a little concerned. Like you haven't ever had an x-ray of your back, or you haven't had an MRI. And this has just been going on a little bit too long. And usually like I have people respond a little more quickly to this. And I don't want to alert you to like the fact that something's terribly wrong, but I would want to be safe rather than sorry. And that just shows you're being responsible as a coach too, to like say, I don't know everything. And, let's make sure that you're okay. And so I think what timeline is that is probably the next question. I think that varies a little bit, and maybe the more experienced of a coach you are, your timeline might be a little bit longer. But if you're starting to feel like uncomfortable and like you're not sure what to do next, and you've tried all those other adaptations, there's nothing wrong with sending somebody to get something checked out. It's a cover your ass situation for sure. But, you would be surprised how much people put up with and don't say sometimes. there are personalities that it's actually a lot worse than they're letting on or telling you. And so for those folks, you might want to definitely, send them sooner rather than later.
That's such an interesting point. Recently, for no reason that we know of yet, I've got a gastroenterology appointment scheduled. I developed anemia, and I only knew because I tried to donate blood, which I've been doing for the last year.
Right.
And this time, the numbers were below where they would accept.
Right.
And so doing my...
Which is unusual for you. Like, you always give blood, right? That's a habitual thing for you.
Yeah, this was and going back through my records, I'm like, oh, this is a year old when this started. I could look at, the numbers and they've been going down. And I realized like there are things that we as coaches sometimes get that first glance on because the first symptom that I would have noticed was when I do high intensity cardio work. That was when performance had been going through the floor. Strength work had been fine. Zone 2 work had been fine. But that high intensity cardio, dyspnea, running out of breath, things going on. And as a coach, like I have that moment as part of a healthcare team, even though it would have been inappropriate for me to diagnose myself. If I had seen another lifter, I could be like, you should see a doc. You should check in.
Right.
Because the lifter may have no exposure to that. For them, that might just be another day.
Right. You do have experience. Like you have experience to know, somebody should have adapted to this by now. Or I usually see people, respond differently here. Like you do have a place. And hopefully as the healthcare system gets better, that, people like strength coaches and, trainers actually have a bigger role in that. Like, so don't shy away from being a referral. And there are some really cool relationships developing now because a lot of practitioners are recognizing that, people who train somebody and work with somebody every day are on the front lines. And, if they have a concern, there are more clinicians, I think, that are willing to listen to like, yeah, especially if it's somebody in your community and you kind of know them and you can refer back and forth. Like that's a beautiful place to get as a coach, where there's people who kind of know who you are and who you're about and what your experience is. And they trust you when you say, can you check this person out? Because something's up here, So you're getting a follow-up then with...
it's just literally I pulled up through Google Scholar looking up, the common diagnoses, the common faults, just because nerdy and curious. And he's my doctor's going down, essentially going down the checklist for likely causes as the same thing, a PT is probably going to do, or a general practitioner is probably going to do if we refer one of our clients to them just to check out. Another thing along that line I just wanted to bring up because I thought about it earlier while you were talking was when we allow our clients or encourage them to test different movements, experiment, and be aware of their pain, be aware of how different movements go, they are better equipped to have that conversation with a licensed provider, a medical provider.
Yeah, that's a great point. Yep. You're like, I have tried that actually, and this hurts or this doesn't hurt, or yeah, that's awesome. Yeah. You've already helped them like ask the right questions of themselves about how they're feeling. You have the experience to sort of say, why don't you try this or try that? Does it work? I don't know. Like, you have a valuable role to play in someone's health for sure. You can't fix everything. We're just part of a team, but we can fix a lot because, training, our bodies adapt and we get stronger, we get healthier, we get better conditioned. And that really can make someone feel 100% different than they did before, which is so cool. Don't be afraid if you see those red flags for sure to refer out. And I think people sometimes hang on too long and don't refer for sure.
I had one kind of scenario question for you. This is something I've faced a couple of times, especially in CrossFit, but even sometimes in strength world, where, you make that recommendation for a referral. And for very valid reasons, sometimes healthcare access is not always that great, right?
Yes.
So for very valid reasons, or just, coach, I'm fine, whatever. You think something is probably wrong, but I'm not going to see a doctor. I'll be fine.
Yeah.
And there's that spectrum from, okay, if something breaks, it breaks. If he dies, he dies. And then on that other side, there's that when it gets bad enough, first do no harm. There's that like, I don't want to be a part of this train wreck when, if this situation blows, like somebody is experiencing bilateral, radiating pain down the legs, like some of these really red flag symptoms. And they're like, nah, coach, I'm fine. I want to train, or anything else, insert problem here, where you as a coach are like, have you faced that situation, and where do you, as you being a practitioner yourself, where would you sit on that?
Yeah, I mean, we face that in the PT clinic too. Like the PT can be like, we're not doing anything else till you see the doctor. Like I've seen it happen because people can be stubborn, or sometimes it is a access to healthcare. That's a valid point. But I've fired someone from block before because I repeatedly asked them to go see a doctor and they did not. And I was like, I told the administration, I was like, I can't keep coaching this guy because it's not safe. And it was a situation where he was having radicular pain and also going off program, like trying more weight than I wanted him to, like wasn't even listening to my advice as far as like, hey, you probably shouldn't be feeling this way. We should probably, so if you have to fire a client, you have to fire a client. Like, I don't want to see someone get hurt worse on my watch, I guess. But, the same thing with like an eating disorder. I've had a couple young ladies with eating disorders. I'm like, you can't train, if you're not eating. And we had them weigh in the morning. And if they lost weight, I was like, go home until you eat something. And I usually talk with their parents. That was like a young lady situation, but don't be afraid to fire someone too. That's your boundary, right? Like that's your boundary, your own personal boundary. And I know some people try to help people that can't have access to healthcare. Like, like they just can't afford it. And that's hard because you do want to help them. And probably really you're giving them more help than if they were on their own because you have a little bit more experience. So that's tough. And most coaches want to help people. That's why they're in it, right? So that is hard, but I would just tread that very carefully because just make sure you're still staying in your scope, right? Like of what you're asking them to do. And I think it's incredibly important that person is at least willing to stay within your guidelines, right? So that, have them do something that's safe. I've actually advised a coach before a kid had a pretty severe, like heart arrhythmia, and he got the okay from the doc, like in written form. And he also like would not let this kid train by himself. And he wore a heart monitor. Like the coach set up some pretty good boundaries of like, if we're going to train, like I want this and this and this in place so that you're not lifting in your garage by yourself and your heart rate goes bad. You know what I'm saying? So, and got the okay from his parents. So there are a lot of lengths you can go to make sure you've set up some boundaries so that the person is safe. But I definitely think you should be careful with that person who you're trying to give a little more help to than, outside the system sort of situation. That can be a really slippery slope.
I really do appreciate you being willing to walk there because so often it's like, oh, just refer out, right. The solution to the coach is presented so often as a general piece of advice that's so easy. And then we hit the track, so to speak. And all of a sudden, oh, this person, I'm probably the best they're going to get. Or maybe like people say, oh, never fire a client, stick with them. You're there to help.
Yeah.
It's like maybe firing a client, maybe like letting them go or saying, sorry, our boundaries aren't going to align here. That becomes the signal where the client goes, oh, like this actually might be serious. If the coach is going to stop taking my money, they're going to refund me. Like
I can't even pay them to shut up. Yeah.
Yeah. And then at that point, maybe I should see a doc.
Yeah, I agree. I think you can set up boundaries for yourself, but like the client has to meet you halfway. And really any good coach-client relationship has give and take, like 50-50, some sort of agreement, right? And so it's the same thing. And you're building that trust with them, but they have to be willing to do their part to follow your guidance too. And I think that's when firing a client is indicated, when they just won't follow your guidelines and they're doing something that is harmful. I mean, I have another guy who doesn't follow my guidelines at all, but he just goes for PRs all the time. He's healthy, he's young, that's not a problem. But if someone is like, I'm going to try lifting 405, but I can't feel my leg, you can't let that go on,
Yeah.
So it's one thing to be off program and it's another thing to do something that's reckless for your health. And so when you're there to try to guide someone, there has to be some give and take a little bit,
Yeah. Well, Bekah, thank you so much.
Sure.
For everyone listening, so Nikki was with us at the beginning and there were some technical issues. And
got hit by lightning. Something.
Rebecca and I just started jamming them and kept rolling with it.
Poor Nikki.
So we appreciate her being here and her contributions. Unfortunately, she couldn't make it to the podcast. But thank you for listening. Rebecca, thank you for coming on. Deeply appreciate it. This was a lot of learning for me too.
Oh, good. Yeah. And I hope if you're out there and you're a coach, and I really think I would recommend our academy program. I'm proud of it though, but I do think it gives you a good solid background to understand your role a little bit more. Like if you've gone through the academy program, you feel pretty confident about, where the boundaries are as a strength coach. So I would recommend that. Like if you're considering it, if you're on the fence and you're like, oh, I'd like to help these people, but they're injured. Like I do think we have a lot of resources to help those of you who coach and want to be a little more confident about decision making with things like that. So just a little shout out for the academy.
Amen.
Just a little one. All right.
All right. Well, thank you so much. Thank you all listening, and we'll catch you around.